So John, you're now 2 months, 8 weeks after a rotator cuff repair. So tell me about your motivation and your range of motion currently.
Well, I'm a very active person and I don't like sitting around, and so I started by trying to do basic skills. So I tried to use my right hand to shave and kept getting further and further, to comb my hair and also to shampoo everywhere on my head, and then also to use the restroom properly. And then I went to physical therapy 3 days a week, but on 3 days a week I did everything myself just to keep extending the spots. And so whenever it would hurt, I would just hold it there and stretch a little bit further, and then I would just go a little bit past the pain every day, and my range of motion just kept getting more and more every day.
So at 8 weeks, do you think you've finished improving, or do you think you've still got a improvement to happen?
I have a couple of spots of improvement. When I go this way, my right arm isn't quite fully perpendicular, and then when I go up, I can feel a little bit of pain still. So I'll work through this way, and then also on my back, I can get between my shoulder blades with my left hand, and I only can get just above the small of my back with my right hand. And so those are the areas that I'm still working on. And I think my range of motion is fully to the right, but it still feels a little pain at the end. So I just need to get to where I don't feel a little bit of pain at the end.
So patient motivation is one of those things that doesn't get talked about very often, and to me has always been super important. So what motivates you to do your rehabilitation?
I think it's just daily activity and having the hindrance gone, because it's not fun to be hindered by immobility. And so I just continue to push the mobility limits every day, and I like to see gains every day. And so
if you were to help other patients be motivated, how would you advise them in terms of improving their motivation for rehabilitation after a surgery?
I think the biggest point is don't be shy to do the exercises you're given, because you do feel a little bit of pain, and I think some of that ends the motivation when you feel the pain. But if you use the ice and the acetaminophen, you can always push the limits. It's okay to feel a little bit of pain and then hold it when you feel the pain, but you don't want to injure yourself by feeling too much pain. So I think just by being able to push a little bit harder and doing the exercises when you don't go to physical therapy, you'll increase that range of motion, and you see the benefits daily, and then you just want to do more.
And you're now 8 weeks after a rotator cuff surgery, so can you show me your motion in flexion, abduction, and external rotation?
And then I can go all the way up, I can go out, I can twist my hands back and forth.
Can you comb the back of your head?
I can comb the back of my hair, I can shampoo everything.
Can you scratch the small of your back?
And so I can go this high up,
yeah,
and this one just goes to there. So and I can go all the way to that side.
So you're not far off. Well, brilliant. John, you're an inspiration, and thank you for sharing your experience.
Sure.